And I've said that all along.
All right, New York State Governor Andrew Cuomo providing his daily update from the Red Room in Albany. We thank you so much for joining us here on WNY News Now as we continue to put facts over fear in our local coverage of the novel coronavirus outbreak. We're now shifting gears to take a look at some of the local COVID-19 headlines coming up in our live broadcast. The number of those who have recovered from COVID-19 continue to climb here locally. Plus, around 80 million are expected to get their stimulus payments this week. What we know about that process in a report next.
Live and on demand, this is WNY News Now.
And thanks for joining us for WNY News Now. I'm Justin Gould. The number of those who have recovered from COVID-19 in our area continue to grow. Officials in Chautauqua County reported no new cases of the virus during their Monday update, but that 18 people now have fully recovered. That number up 5 from Easter Sunday. There remains a total of 3 active cases here in the county. The Cattaraugus County Department of Health has reported no change from Sunday as well. And a return to normalcy following the coronavirus outbreak. That's what President Trump and many other leaders are now hoping for. But when is the right time to try to achieve that? John Lawrence has more.
Uncle Sam opening his wallet, starting to send out stimulus checks. 80 million Americans should receive payments this week. It's one of the first major steps taken to get the U.S. economy, battered by the COVID-19 pandemic, back up and running.
We will soon finalize new and very important guidelines to give governors the information they need to start safely opening their states.
A number of states on the East and West coasts are working on plans to reopen, but there's no official timetable.
Do it carefully, do it slowly, and do it intelligently. More testing and more precautions.
That cautious attitude is shared by governors from both parties.
We must reopen in a way in which we are able to stimulate the economy while at the very same time ensuring that we contain the spread of COVID-19.
And an influential coronavirus model often cited by the White House predicts the pandemic could end by summer if social distancing continues through May.
It leads to a situation where every case is infecting less than one other case. And that means if you keep the course, you'll get transmission essentially down to zero.
Other experts say the model's projection, which only goes until August, is unlikely, if not impossible. I'm John Lawrence reporting.
All right, John, thank you for your reporting. And yesterday, as you may have watched live here on WNY News Now, New York State Governor Andrew Cuomo joined other regional leaders to discuss a plan to reopen the economy. Now, Governor Cuomo was joined by 5 other governors to make the announcement. Listen.
Each state is going to name a public health official for that state, an economic development official for that state. Those officials and the chief of staff of the governor of each state will then form a working group that will start work immediately on designing a reopening plan, taking into consideration the public health concerns and issues and the economic reactivation issues and concerns. Study the data, study the research, study the experience of other countries, and give us guidelines and parameters to go forward.
The governor says the reopening objective will be to ease isolation, increase economic activity, reevaluate what's considered to be an essential worker, have more testing and precautions, and not increase the infection rate. Now, a date for when the plans will be made available has not yet been released. Meanwhile, President Donald Trump says that he has total authority to decide when the country reopens for business, and he plans to make the final call. But legal experts and Governor Cuomo, as we heard during his remarks just a few moments ago, says that the Constitution does not give him the authority to make that decision. Now, powers not listed in the Constitution are left up to the states. That's according to the 10th Amendment. Well, as for the stimulus checks, the IRS says if you've already filed your tax return for this year and have authorized direct deposit, you're most likely to see your money dropped into your account soon. Treasury officials say most eligible Americans will receive their payments within the next 2 weeks. People who don't file tax returns can either enter their information on the Internal Revenue's website. Now, taxpayers who do file but don't use direct deposits will be able to enter their bank information later on this week. Everyone else will have to wait for paper checks, which could take considerably longer, officials tell us. The money is from $2.2 trillion in stimulus money appointed by Congress. It's aimed at keeping Americans and the economy afloat during this time. Well, Jamestown Public Schools, in collaboration with other educational institutions, are hosting virtual college tours for students this week. School officials say the online sessions are available for interested students to obtain information, ask questions, and partake in a virtual tour of campus. Niagara Community College, Penn State Barron, Gannon University, and Mercyhurst College are all part of this online tour. The virtual college visits are a collaboration with SUNY JCC and the Liberty Partnership Program. For more information, students are asked to contact the district. We have a link with more at WNYNewsNow.com. Well, a local restaurant will be dishing out free meals for hospital workers in Jamestown tomorrow. Basil and Bones in Frewsburg will set up their food trailer at UPMC Chautauqua Hospital from 11 a.m. to 2 p.m. and then from 6 to 8 to provide complimentary meals to doctors, nurses, and hospital staff. Now, restaurant officials say they're also thankful for the medical professionals who are on the front lines putting themselves in harm's way and want to show their appreciation by offering a hot, homemade meal. That certainly is amazing, and we thank them for that contribution. If you remember, last week, first responders, city staff, and community members surprised those at UPMC Chautauqua with a special salute amid the COVID-19 outbreak. Well, we thank you all so much for joining us here on WNY News Now as we continue to put facts over fear in our coverage of the local coronavirus outbreak. Got to say hello to Michelle. Hopefully you're doing well. Good to see Lakeith here on the broadcast. Stephanie, David, Sammy, Brian joining us here on Facebook Live. Hello to Pam, TR, Joe, Kevin. Great to see you all, and we thank you so much for sharing your comments with us down below. Let's switch gears and now get a check of our First Defense weather forecast, and that's where Chief Forecaster Dakota Hunter comes into play. And Dakota, last night it was a hold on your hat kind of weather because it was pretty windy out there.
Yeah, it was. I mean, we had the winds blowing around yesterday. It was pretty windy yesterday, but the winds have calmed down for today. Here's a live look coming from the Mill Creek Mall in area. You can see the clouds above. The clouds are thickening up from west to east today, but look at this dew point of 18 degrees. That means high pressure has built in, and even though the clouds are starting to filter in, you can see it here on the satellite and radar composite. The clouds are filling in from west to east today. The winds are down a little bit, but it's still going to be a bit brisk through the afternoon. We also had some heavy rainfall, especially early in the day. Most areas across the southern tier picked up around a half to 3/4 of an inch of rainfall. Once you work out farther to the east and to the north, the rain totals drop off there. How about Bradford, Pennsylvania? 1.09 inches of rain yesterday. That was the 24-hour rainfall total. We squeaked out 58 yesterday, but that was an early morning high. Temperature slid all the way down into the 40s, and 80 and 13 are in the record books for today. So through the afternoon today, partly sunny early. The clouds are already starting to increase from west to east today. A brisk breeze, otherwise a colder day. 39 on the highest hills to 45 at the Lake Erie shoreline with a west wind 10 to 20. Some wind gusts still could be around 30 miles an hour. Cold air continues throughout much of this week, and next week, still a little chilly. We'll talk about it with the 7-day in just a few minutes. Justin?
All right, Dakota, thank you very much. Coming up, we check back in with how a major local nursing home facility is faring amid the COVID-19 outbreak. Stay with us as WNY News Now continues next.
With coverage that matters, this is WNY News Now.
EagleZip.com is your local one-stop shop for all of your home and business computer needs. Located on Fluvan Avenue Extension, just outside of Jamestown, EagleZip.com sells and services all brands of desktops and laptops, as well as servers and network equipment for your business. All new computer sales include transferring your data from your old computer plus a 2-year warranty. Call EagleZip.com today.
Stop by EagleZip.com today and let us make computers easy for you.
This is Christine Schuyler, Chautauqua County Public Health Director, with a very important message. We need you to make every effort to protect yourselves and our healthcare workers. If you absolutely don't need to go out, don't. If you have a mild cold or flu-like symptoms, with or without a fever, stay home. If your symptoms are severe, call your healthcare provider. Do not go to the emergency room or urgent care. Do not call 911 or go to the ER unless you are experiencing a life-threatening emergency. The best ways you can help prevent the spread of COVID-19 are to wash your hands often with soap and water, cover your cough, avoid close contact with others. Please stay home.
You're watching WNY News Now, your source for breaking news.
And welcome back to WNY News Now. It's been nearly a month since one of the area's largest nursing homes closed their doors to all outside non-medical visitors in an attempt to stop the spread of COVID-19 to protect its residents. Joining us on the broadcast is David Smeltzer. He is Heritage's Ministries President and CEO, to talk more about their operations and how they're faring. Mr. Smeltzer, it's a pleasure to have you back on the show. Thank you for being here. Well, unfortunately, it seems like we're having some sort of audio issues still. I'm not 100% sure what is happening. We were able to hear you a little bit earlier on in the broadcast. So if we can, let's turn to Chief Forecaster Dakota Hunter, if that's possible, and we'll get a full check of our weather forecast, and then we'll try to bring it back to David here with more in just a minute. And Dakota, as we were talking about before the break, really the winds was a big deal last night for a lot of people.
Yeah, it was. And these were the peak wind gusts we had throughout the day yesterday. These were at the airport locations in the spotters. Fredonia had the peak wind gust at 65 miles per hour. That's at the Mesonet site that's located in Fredonia. Dunkirk at the airport, 59. Delavan, 56. Jamestown at the airport, 51. Erie, 48. Olean, 45. And Randolph, 41. Now, yesterday, I went out in our storm interceptor and I took a drive out to Erie, and I was on Peach Street in Erie, and I could literally see the power poles swaying back and forth in the wind, and that was a really neat thing to see. Now, in terms of the winds, we talked about this yesterday about how the models trended downward with the wind gusts. So why was it not as windy as we had originally thought? Well, it has to do with the cloud cover. We told you about this on Sunday in the web story that we posted about how the cloud cover, or the lack thereof of any cloud cover, could actually increase the winds. Well, here's the reason why. Way up in the sky above the cloud level, the winds up here were about 65 to 75 miles per hour. If we actually got some cloud breaks, some of that wind would have made it down here to the surface. But because we had the cloud cover, it acts as a roadblock. It stopped it in its tracks. So the wind speeds were not as great as they could have been. So the winds down here at the surface were between 50 and 60 miles per hour, with the exception of Fredonia. But again, that's right near the Lake Erie waterfront. And that wind, with that west to northwest wind coming directly across the lake, often one of the windier spots. So that's the reason why it was not as windy there, especially down here. HD News Now cam shows you the clouds starting to fill in downtown, but at the airport, still just a few clouds reported at the airport. 36, northwest wind of 13, and yeah, we have a wind chill index of 27 degrees. Can you believe we're talking about a wind chill in April? Can you believe that? So the clouds thickening up through the afternoon, cold air all week long. Sorry. I mean, it's just going to be chilly all week. We don't see any 50s in sight until the second half of the weekend, and we are going to see, that should say snowflakes, not whatever that is, snowflakes from time to time. Anyway, let's fast forward here. We'll show you first Defense Doppler radar. We'll show you nothing across on the live scan today, but zooming the radar out, there's an area of high pressure that's built into our south, so that's the reason why the dew point temperatures are actually nice and dry today, a good indication of high pressure, but we are going to see just a few scattered snow showers coming our way later tonight and tomorrow. Here we go with Future Scan. You can see it shows the idea of nothing through the day. Tonight, it tries to paint a few rain and snow snow showers across the southern tier. Wouldn't necessarily rule that out. But again, it's going to be wet. I don't expect any accumulation out of it. Tomorrow, just a few snow showers possible in the morning. Then it will start to regenerate as we go into Wednesday night, going into Thursday. Another storm system coming our way Thursday and Friday may bring us a chance for some wet snow. That still needs to be determined. Too early to know any details on that just yet. But of course, we'll keep you updated right here. And don't forget, Storm Spotter training tonight at 7 o'clock, hosted by the National Weather Service in Buffalo. Again, we need more storm spotters. It's very, very important that we need you guys because you're the only people that see down at the ground. And it's free to attend these sessions. To sign up tonight, go to weather.gov/BUF/Skywarn. These training sessions are free to attend. It's fun for the whole family. Anyone from 9 to 99 can attend these sessions, and we highly encourage that. We need more spotters. Inland areas today on the zone forecast. Temperatures today, this is not April-like. This is more like March temperatures here. Lower 40s for most areas at a very cold day, but the winds will still be up just a little bit. How about we take a look at the next 7 days of your life that are coming up right now? 39 tomorrow. That is way too cold. We stay in the upper 30s on Thursday. Chance for a few rain and snow showers both days. Friday, we stay cold there. A few wet snow showers. Again, that's the next of our storm system that we're keeping an eye on. We're still cold on Saturday, but mainly dry. A better day, used figuratively, on Sunday, back into the mid-50s, but a few rain showers at times. Another frontal system moving our way early next week will drop our temperatures back down into the lower 40s with a few rain and snow showers. Justin?
All right, Dakota, thank you very much. Joining us back now is David Smeltzer. He's the president and CEO of Heritage Ministries to talk about how their facilities are faring during this COVID-19 outbreak. Mr. Smeltzer, thanks for being here. It looks like we've worked out the audio issue now.
Thank you for having me, Justin. It's always a privilege.
First off, I wanted to ask you, how are your facilities doing amid this outbreak?
So far, so good. All of our skilled nursing facilities and assisted living communities here in Chautauqua County are COVID-free at this point in time. We have certainly tested some folks who exhibited certain signs and symptoms, but all of those tests have come back negative at this point in time.
Now, regionally, there's been a concern from nursing homes about residents contracting the virus. Those tests that you've mentioned, they've all come back negative. How many have you seen?
We've tested probably somewhere between 8 and 12 residents in our communities here locally. The fact that we've been essentially locked down now for about a month has really helped to prevent the infusion of the virus into our facilities, and all of our staff are wearing surgical masks throughout the day when they're caring for residents and walking the halls. So that helps to also keep any spread down inside the facility should it come in from one of our staff members.
Now, that concern, were the residents presenting symptoms of COVID-19? Is that why they were tested?
So we evaluate our residents, the skilled nursing facility residents, 3 times a day with temperature checks, and we're also now doing pulse ox checks as well in those folks, because that seems to be one of the indicators is a low oxygen content in their blood. And so they would have they would have either exhibited a fever or a low pulse ox, and that would have then put us into immediate precaution mode. And we would have been donning full protected, personal protective equipment at that point in time and performing the tests. Unfortunately, many of those tests took 4 to 7 days to get back, and so our staff were forced to wear the full PPE throughout that time. But again, thankfully, all those have come back negative, and we understand that UPMC Chautauqua now has a more rapid test, and we should be able to get results within 45 minutes to 4 or 5 hours. And as nursing home communities, we are at the top of the priority.
Now, the testing process, I know we talked a little before the show, is that administered through your facilities, or is it administered through, say, a resident's general primary care doctor that they would see?
So that varies, Justin. If it's a patient in our rehab and skilled nursing facilities, our medical director orders the test, and our nurses take the swabs, and that is sent off to Chautauqua UPMC. If it happens to be in one of our assisted living facilities, that has to be run through their medical provider, their primary care provider, because we are not technically the medical care provider in an assisted living facility. That goes beyond what DOH permits us to do.
Now, if someone did come back with COVID-19, what is that process look like?
Well, Well, Justin, we have, that's of course the biggest concern of infusing, again, this virus into our facilities. And so we have taken precautions and already created an isolation unit at our Heritage Park facility that is, can take care of 8 residents. And that is a separate and distinct unit in the facility that is not adjacent to any other resident care locations. And the staff who would be caring for patients in that area would be dedicated staff and would not care for anybody else in the facility. That's whether the facility has an in-house developed case or whether we'll be asked to admit somebody to offload patients from the hospital to help with capacity there, admit somebody that is a known COVID positive patient. They would be admitted to the area as well. We also have a similar space available at our Heritage Green facility. We have the supplies to build that unit right now. And so we're just waiting to see if there's demand before we physically construct the unit. It takes less than a day for us to put that together and be prepared to take those residents. Any other residents that we admit that don't exhibit signs of COVID-19 are still placed into an area of our facility that's a quarantine area. And those residents are watched very closely for 14 days to make sure they're not exhibiting any signs or symptoms, that they haven't brought it in unknowingly, unlike those that we know for sure are positive.
Now, is there a plan to contact family members of residents if, say, they're exhibiting symptoms and a test has been ordered? And then eventually, if that test does come back positive or negative, are they contacted, or is it something that that resident would have to do?
No, we absolutely, in the skilled nursing community, we are absolutely required to communicate with the appropriate healthcare family members, those who are permitted to have that information. We're required to communicate with them any change in condition, and certainly suspicion of COVID-19 would be one of those cases, and then we would notify them immediately upon results. Again, in the assisted living world, it's a little bit different. We have to then rely upon the family members to get back to us and let us know whether or not that test was positive. We did have a resident in our assisted living facility that was hospitalized and tested, but the test results came back negative. So we're, again, still very thankful that we've had no positive tests in any of our assisted living or skilled nursing facilities in Chautauqua County.
Now, is that a concern where if they were living in that assisted living and maybe that communication didn't take place, how do you sort of verify that everybody else, okay, a resident from assisted living went to the doctor, got tested for COVID? How does that work? Because it seems like if that communication, it's a slippery slope, I would imagine, legally, where if the family didn't want that communicated.
Well, they're required to communicate back to us as a result of the fact that it's a positive COVID test, because we would then be required to make sure that we're paying attention to what's going on in the facility and hopefully even be able to get others around that patient resident tested should they exhibit any signs or symptoms. So we just stay on top of it. If we know we have somebody that's been tested, we continue to communicate with family members to make sure that nothing falls through the cracks.
Right, and at the end of the day, it's about just keeping everybody safe for sure. And on that note, personal protective equipment, better known as PPE, has been in short supply nationally. I know we talked before a few weeks ago where you said you were having a good supply of it. How is that supply now?
We are still working well with Chautauqua County has been working with us to get the products we need, and I think the supplies are starting to open up a little bit more as more and more entrepreneurs are getting involved with the business. Our biggest concern right now is not our current status, but would be the status if we ended up with a large outbreak in one of our facilities, which again, we don't foresee at this point in time. You've heard of that happening in other communities, but with a lockdown now for over 4 weeks, the likelihood of having a large outbreak in a community here in Western New York, let alone one of our facilities, is much less likely because of the precautions that we've been taking. We would expect more likely to be a scenario where we would have to admit somebody who's already positive, or we have one person maybe that contracts it and we move them to that dedicated unit. And so you'd have fewer people using the personal protective equipment but staying on that unit. So it wouldn't have to be changed out as often. And so as long as that's the case, we should be okay. If we were to have, God forbid, one of those large outbreaks, we'd burn through some of the gallons and other things pretty quickly.
Now, you mentioned the county officials and some of those local entrepreneurs. In order to replenish your supply going forward, especially if it does become low, what's that process like? Is it something where Heritage would purchase the equipment, or is it where maybe a county or a government kind of steps in?
It's a combination, to be honest with you, Justin. We have a purchasing manager who is constantly out evaluating the marketplace and trying to make sure that we have what we need. But the New York State Department of Health has also tasked the local emergency management groups. So right here in Chautauqua County, our emergency management group has access to some supplies as well. And as they get them, they communicate with us and often send those our way. So it really is a combination of those two approaches.
Now, a few weeks ago, we had you on the program talking about the need for workers at your facility. Since then, have you had a good response from the community? And is there still a need for the various positions that were advertised?
We have had some response from the community, but we're pretty much always looking for good, compassionate caregivers, and now is certainly no exception. We can always take more folks. Again, one thing about working in the healthcare world, especially in long-term care, we're always open 24/7. I mean, hospitals even have some ebb and flow in regards to their capacity and demand, but nursing homes are quite often at capacity or close to capacity, and we're almost always in need of qualified staff. So that's the case right now. We have been impacted slightly by some folks who are actually interested in going out to New York City or some of the places that are offering large pays for a short period of time in order to come during this crisis. We're hoping that our staff stay committed to the residents that we've been caring for through the years and committed to our organization so that we can continue to provide the care that we need to in our facilities.
And even though the visitation is restricted, we've seen some of those amazing images coming from your facilities where residents, families, and friends are visiting them through windows. What is your thoughts on that process? I know we're rolling some of it now. I mean, it's really breathtaking to see the community still staying so strong during this.
Right. We are happy to try to do anything we can do to reconnect the families with those who are under our care, including window visits, telephonic visits, video visits. Window visits are a unique way for them to physically lay their eyes on their loved ones, and those are appropriate given the appropriate precautions. It should not be more than one family group at a time. We ask for not more than one visit per day for a resident per time so that everybody has an opportunity. And of course, we don't expect any large gatherings. There should be no large birthday party celebrations with a group of people gathering around the window, unless, of course, they're staying significantly far apart and practicing good social distancing. But we really encourage small visitations for windows, one household at a time. Bring your pets. That's always a wonderful thing. We've had the advantage to have some of our horses go down from our Homestead stables here in Gary to our Heritage Village facility and visit the residents through the windows. And so that's been a fun thing too. The residents really have really adapted quite well, and for the most part, and are accepting of the situation more than, in some cases, family members. I think it's more difficult for a family member to not be able to visit their loved ones. But I love those whiteboard notes that you see that are going out through our facilities where we're passing messages along to family members through those whiteboards, and just staff who are doing an incredible job day in and day out to provide care and to provide for the mental well-being of our residents as well. I cannot tell you how much I appreciate our staff going into the facility every day, putting their own needs aside and caring for those whom God has entrusted to our care at our facilities.
Yeah, and really that's it right there. Kudos to your staff and your leadership for trying to provide that positive light throughout this whole pandemic, because I know for everyone it seems like there's a lot of nerves going on right now, a lot of worries, and it's good to see those smiling faces. I mean, this might sound silly, but just preparing for this piece, looking at those pictures, I'm like scrolling through them all because it's so nice to see the smiling faces of it, because you would want to say, you know, if it was my grandmother in that position, you know, I would want them under that level of care. So David Smelter, the president and CEO of Heritage Ministries, joining us on the broadcast today. Sir, we thank you for your time and appreciate you being here.
Justin, thank you. Thank you for having me here, and stay safe.
Yeah, absolutely. You too. That's going to do it for us today. Of course, news continues 24/7 at WNYNewsNow.com. When you're on the go, you can stay in the know by downloading our mobile app. Just search WNY News Now in the Apple App Store and the Google Play Store. We're back tomorrow right here live at noon talking with Jamestown Mayor Eddie Sundquist about his local response. We'll see you then.